Hi, I'm Mike from Turtle Medical. Today we're going to talk about the enhanced public access trauma kit. The PAcT kits were developed as part of the work done on the Terrorism Protection of Premises Act 2025, which is more commonly referred to as Martyn's Law. It requires venues to undertake risk assessments. Part of the risk assessment undertaken will ensure that the right medical equipment is on site to deal with a terrorist attack, and that's where the PAcT kits come in. From many years of producing the Baird Foundation kit and working with various ambulance services, Turtle Medical have developed the enhanced PAcT kit, which includes all the medical equipment included in the Baird kits and the additional equipment specified as part of the standard for the standard PAcT kits. This will enable public to access the kits in an emergency, a terrorist attack or similar, and control catastrophic bleeds, undertake CPR, all in a safe, controlled manner. As with all emergencies, the number one thing is to take care of yourself. You shouldn't go into a dangerous environment. You need to kind of check the area is safe before you go and help a patient. It's also really, really important to remember to call 999 and make sure you've got a paramedic coming to back you up. So what's inside a PAcT kit? Let's open it up and find out. The enhanced public access trauma kit comes in two sections. So in the first section, we start off with a first aid memoir. It gives the basics of undertaking triage, following the Dr. ABC, how to undertake CPR and how to undertake bleed management. And on the other side there's a nice contents list to allow checking and auditing purposes and the contact information. So in this side it's more about the critical injury management side of things. There are 4 of the trauma dressings for covering wounds. It works well for a medium wound. If it's a larger wound, you'd pack it with a gauze first. There are 2 quickly accessible anti-elastic holders on this side, and in the zip compartment on the other side there's a further 2 trauma dressings in here. So if you have multiple casualties or a casualty with multiple wounds, you've got lots of trauma dressings available. There are 2 tourniquets. Each tourniquet comes with its own marker pen, so when you put it on it's important to record the time that it was placed on, so later in the hospital they know how long it's been on for before they remove it. There's the vented chest seal. This is a really important device for using on a puncture wound to the chest cavity. The risk here is that air enters the lung cavity and it crushes the lungs, preventing the casualty from being able to breathe. The chest seal seals the hole, but it also has lots of micro one-way valves on it, so it allows air back out as the lungs try to inflate to allow the casualty to breathe again. The Haemostatic gauze is a really, really clever device. It's impregnated with a clotting agent. This means when blood comes into contact with it, it starts clotting instantly. This is used to pack really large wounds. You could have a massive open wound, even an amputation, and this will be used to pack the wound before it's then covered in one of the trauma dressings. In this side, as it's more about the bleed management, we also include one of the Baird Foundation body maps, which just gives a really basic overview of where to use each component. On the other side, there's a second copy of the aide memoir, just so if somebody opens the kit this side first, they've got this information available to them straight away. This side's more about the PPE and the patient protection. So there's 2 pairs of goggles. This is to protect the eyes of the rescuer in an emergency situation. We have 2 emergency shears. These are mainly used to cut clothes off or cut seat belts or anything like this to get to the casualty's wounds. They can also be used for cutting down wound dressings if required. There's 2 foil blankets. It's really important to keep a patient warm and dry if they're outside, so this can be used after all the treatment's been done to wrap the patient up until the emergency services arrive. On this side of the kit it folds out nicely. In the first section there are 2 CPR face shields. So if you're undertaking CPR, it has a one-way valve, so when you're breathing into the patient's mouth, it's quite common that somebody can be sick or vomit when they come round, so that won't go back into the mouth of the rescuer. It also offers a bit of protection, especially if there's any facial injuries, which could be off-putting from somebody undertaking CPR. There's a couple of standard face shields. It depends on the situation. They're probably not going to be needed in most situations, but they are there as an option for the rescuer to wear to make sure they're not breathing or contaminating the patient. In the next section we have 2 pairs of gloves. It's very important to, especially if you've got dirty hands and you're touching somebody's open wounds, to not infect them. So having gloves for the rescuers to wear is really, really important. And finally in this section we have 2 triangular bandages. These can be used for various things. They can be used to make a sling with if a casualty has a broken arm. They can be used to wrap around on top of the trauma dressings if additional coverings are required, and just a general purpose bandage really. And that is the contents of an enhanced public access trauma kit. As well as our enhanced PAcT kits, we also do a wide range of other trauma kits. More information about all of these kits can be seen on our YouTube channels, on our social media, and they can be purchased from our website, turtlemedical.co.uk.